Hello, my name is Dr. Osman Miyanji. I'm a child neurologist by profession. I'm the chairman of KAWE, which stands for Kenya Association for the Welfare of People with Epilepsy. I'm going to talk about the management of epilepsy in Kenya, in the community, and the experience that KAWE has had at this first African Epilepsy Congress in Nairobi. The KAWE was founded in 1982 by a mother of a child with epilepsy, and she felt sorry for many needy children who could not access good treatment from the public service because most of the basic drugs for treatment of epilepsy was not available. We have a vision, mission, statements and goals, but our main objective is to develop a sustainable, comprehensive and integrated epilepsy program that is affordable and accessible to people suffering from epilepsy in Kenya. We have developed over the years 3 major programs. One is education, awareness and training, which involves creating awareness and educating the public. And then we like to train health caregivers of all levels, from doctors to clinical officers right down to the community nurse at the dispensary. Then we also would like to provide medical support and clinical support, which means that we will run special epilepsy clinics where we can provide care for people with epilepsy. And the last one is to lobby and for advocacy of people who suffer with epilepsy and their families. Our clinics, within our clinics, we have shown that epilepsy can be treated quite well with just basic drugs. And from the pie chart, it is quite clear that we are using mainly very cheap basic drugs: phenobarbital, phenytoin, carbamazepine, and sodium valproate. The cheapest drugs are phenytoin and phenytoin and phenobarbital. Carbamazepine and sodium valproate, we get generics at a very reduced cost, much less than the market prices. And we have already shown that 84% of the patients can be controlled on just one single drug. Only few patients are taking 2 drugs or 3 drugs. During our training program, just to show an example of what we have achieved so far, in 2011 alone, we have trained many medical personnel and community health workers and even local teachers about epilepsy. The figures are shown on the slide. Regarding the awareness creation, which is a very important part of our mission, is to create awareness and to educate people to understand epilepsy. The biggest problem with epilepsy is that it carries a huge social stigma and negative feelings about epilepsy. So we need to clear that ignorance by educating people. Now, creating awareness creation activities, as you can see, we have had many sessions and we have reached many people of different uh, stations and different types of people as shown on the slide. And through the mass media, we have been able to reach almost 1 million people. We have also distributed a lot of information material in the form of leaflets, brochures, and booklets, posters, etc. And just in 2011 alone, we reached 800,000 people by this distribution. And I think this is very helpful for educating people to reduce this ignorance, and by reducing ignorance about the disease, we hope to reduce this biggest problem of social stigma, where the society rejects people with epilepsy. Our medical support program, we run 3 different clinics in Nairobi, and we have about 12,000 patients who are registered with us, and more than 4,000 patients are actively being followed up by us, and we see quite a number of patients as shown on the slide. There is some cost sharing because we sell some of our drugs at a much reduced price, which is almost a fifth of what the price is in the open market. We do not charge any consultation fees or any other fees, but if the patients are poor, then at least 40% of these patients are provided free drugs. Overall, over the last many years, our achievements are now summarized here in this slide. Firstly, over the last few years, the Ministry of Health has now recognized our work and now is supporting our activities by releasing their staff from the clinics right from the grassroots to attend our training programs. And they have recognized epilepsy as a disease to be reported, so they have included it in its morbidity sheet, as we refer to. The idea of training people is to improve the knowledge. These are caregivers, the health caregivers, to improve the knowledge so that give better care to patients with epilepsy, and they should not feel afraid of treating them. Then we have had many educational material that we have produced, and among them we have a training manual for medical officers and for clinical officers, which we are proud to say has been accepted by the global campaign against epilepsy and is adopted by them to be for worldwide distribution. Currently it is undergoing some revision before it is released again and translated into several languages. So far we have trained more than 2,000 medical personnel plus community health workers, and we have helped in opening about 15 clinics which we support. Of course we can't run all of them, we're short of staff, but we provide our expertise. We also help in formation of support groups who can then continue our work in the community at the grassroots levels. In the past, when we had a lot of funding, we had almost 15 clinics around the country. These clinics were devolved and passed on. The patients passed on to the nearest health facility, run by mission missionaries or church organizations or by the public health sector, and we have only remained with 3 clinics in Nairobi, and these clinics are still running, and we still continue supervising them and supporting them from Nairobi. Next. Unfortunately, there are many challenges that are experienced within Kenya as well as the rest of Africa, and these are again the issue of the traditional beliefs and attitude towards epilepsy, which I referred to earlier. There is this issue of social stigma, negative prejudices, and we have a huge treatment gap as a result of these social problems. The treatment gap is estimated in Kenya to be more than 80%. What it means really is that out of the patients, which we estimated in Kenya to be about 800,000 patients who suffer from epilepsy, 80% of these patients do not get treatment at all or do not get adequate treatment. It is a frightening figure. So our efforts should be towards reducing this treatment gap, and KAWE has shown that it can be done in an affordable way. And first, of course, by trying to reduce ignorance, because the social stigmas and all these negative feelings about epilepsy are purely out of lack of knowledge, lack of understanding of the disease. Once you help them understand the disease, people learn to accept. So our work has been directed towards that, and I think we have achieved quite a lot. Of course, the government has its own priorities dealing with primary health issues, and epilepsy is not among the top priorities. So as an NGO, we are trying to encourage the government also not to neglect the epilepsy, because 1 million people is not a small number of people. So we are helping them and, of course, pressurizing them to train people, to provide better care, and also to make sure they provide all the drugs, even the basic cheap drugs, at every clinic, so that people with epilepsy do not have to come to the city just looking for medicines. And most of them do not have that money even to buy the drugs or even to travel to centers beyond their home areas. So, and of course there is always a problem of compliance of taking medication. Epilepsy is a disease where you need to take your drugs regularly to keep in control. But some patients, for various reasons, do not continue taking drugs. It's maybe because they cannot afford to buy drugs, maybe they don't understand why they have to take drugs for such a long time, and several other social issues may prevent them from taking drugs. And of course, NGOs like ours need donor support to continue our work, because we have no other source of income. And we don't have enough resources to look after all the people with epilepsy. So we try our best to influence government policy to help look after these patients. And obviously, donors cannot continue supporting you forever, because this disease is not something you can treat and forget about. So there is what we call donor fatigue. In fact, KAWE at this point is experiencing practically 60–70% reduction in funding right now, and we have tailored our activities and reduced our activities and our staff because of now lack of funding. But we'll continue working as long as we get some help. So Has KAWE made any contribution over the 30 years that it has been in existence? I believe so. We are known countrywide now, that we are now the experts in epilepsy, and people believe in us because we have shown that we can treat patients and quite cheaply, and people are beginning to understand epilepsy in the areas that we have worked in. And we hope in the future the government will take over our function when we run out of funds, but we can only make a small contribution at a time. And we pray for people with epilepsy, and we hope in future we'll be able to reduce the treatment gap. Thank you very much.